Welcome, everyone. Thank you for coming to our webinar. This is a new era for cats, groundbreaking FIP treatments explained. So I'm really excited about this one. My name is Caitlin Durkin. I am the manager for Network Partner Relations, and I'm just here to get us started. All right, so first of all, and very importantly, I want to start by talking about why we are all here. So this is a picture of Judo, who was the cat of one of our panelists. So we are all here because we care about the animals, because we have lost animals to FIP. But I really appreciate everybody in this room, our panelists, our live attendees, people watching the recording, because you're the kind of people who experience loss and then figure out how you can prevent that from happening in the future. So just deep appreciation for everyone here. I'm going to get through just the housekeeping before introducing our amazing panelists. There is raise credit available for attending this webinar live. Make sure that you have joined as yourself. So we're going to be matching the name that you submit via a QR code at the end of this session with our attendee list. So sharing accounts to get onto the Zoom will make it a little more challenging to get you that credit. So a couple of things. Feedback. We really appreciate your feedback. I know you are very busy people with lots of cats who need your help. So I don't want to waste your time. There's going to be a 1-question survey at the end of this webinar that will let us know how we did so we can improve moving forward. If you have any more feedback for us, please get in touch, bfnetwork@bestfriends.org. This is going to be an intense and dense webinar, lots of important medical information here. We will send you the webinar recording as well as the presentation deck so that you can go back to it whenever you need it. We're also going to ask you to interact with the Zoom in 2 ways. And Zoom likes to change things up. So I have a little bit of a tour here for us. So you have the chat, you're already using it, you know how to do that. There is a button to select who you're talking to. You can choose everyone or just the host and panelists. We also have a Q&A, and this is the most important one. This is where I want you to put any questions that you have for our panelists. Our chat, I think, is going to get really busy and hard for me to keep track of. So if you put the question into the Q&A, I'll be able to see it quickly and actually ask it of our panelists at the end. And then finally, if you would like to use closed captions, it has been enabled on our end, but you also need to enable it on your end. So you want to click that CC in the box until it says hide captions, because that means your captions are showing. All right, so we're done with the boring stuff, and now I can do the good stuff. All right, I want to introduce you to our panelists today. Speaking about diagnosis, treatment, and follow-ups, we have Dr. Colleen Guilfoyle, veterinarian of National Shelter Medicine at Best Friends Animal Society, as well as Dr. Jennifer Bledsoe-Nix from the ASPCA. After that, we're going to talk about the future of FIP treatments and some research. For that, we have Dr. Samantha Evans from the College of Veterinary Medicine at Colorado State University, as well as Nicole, Jacque, FIP researcher and co-founder of FIP Global Cats. Really excited to have all these people here. Again, my name is Caitlin, and I put it there just in case you want to get in touch with me or anyone else at the Best Friends Network. It's bfnetwork@bestfriends.org. And with that, I turn it over to Dr. Colleen and Dr. Jennifer.
Okay, I will start us off by discussing a little bit about prevention. So we aren't going into too much about pathogenesis of FIP today, and we're trying to keep it pretty practical for you guys and just to discuss things that can have an impact on our populations. Can I have the slide advanced? So as far as prevention, we do know that stress can be a key factor in the onset of FIP, and we do know that cats that come from multi-cat households or catteries or potentially shelters are at higher risk of developing FIP. So I wanted to highlight the importance of population management, including reducing overcrowding, reducing your length of stay, and stress mitigation. I included a picture here from the ASV guidelines about housing we should strive for when we're housing animals in our animal shelters. So multi-compartment housing, places to hide, places to get away from where they're using the bathroom are all things that we should strive for. The ASV guidelines, Kayla just dropped a link to those in the chat and have a lot of good information about cat housing and cat welfare. Go ahead and advance the slide. As far as diagnosis, there are some cases of FIP that are extremely straightforward, and there are other cases that are less so. So I'm going to talk about a few of the things we think about when we're talking about an FIP diagnosis. So initially, FELV and FIV testing is important when we're talking about a cat that potentially has FIP. This is because both retroviral diseases can be a risk factor for developing FIP, and also because some symptoms of FELV can cause similar clinical signs to FIP. So it's just a helpful additional clinical information. We do know that FIP has a hereditary component, and so if we have FIP in other littermates, our clinical suspicion of FIP increases. In cases of effusive FIP, we can look at the effusion that is present, which can be abdominal, pleural, or pericardial. And we can look at that effusion in-house by looking at things like total protein, cytology, and performing what's called a revolta test. We can use PCR, certain types of PCR on this effusion if we want to achieve a definitive diagnosis, but that isn't always necessary for getting a diagnosis of FIP and deciding when to begin treatment. Neuro and ocular FIP they can be a little more difficult to diagnose because there are other disease processes that look similar. But if we have neurologic disease with fever or other littermates that have FIP or a retroviral disease, we should be thinking about neuro FIP, especially in young cats. Ocular disease, we typically see uveitis, but we can also see hyphema, we can see precipitates, and we can see other manifestations of ocular disease. Number 5 here, the nonspecific clinical signs can become quite difficult to interpret. So things we might see on blood work are anemia, increased globulins with an albumin globulin ratio of less than 0.4, sometimes increased total bilirubin. And then when you're doing your physical exam on these cats, you may find that they have a fever, they may fail to gain weight, or they may lose weight, and often they have an unthrifty appearance in general. For our reasonably definitive diagnosis, sometimes we are able to achieve this if we have a fusion and we have a positive FIP RT-PCR test with specific mutation. And so IDEX is a lab that can currently test for this specific mutation, but it's important that we're just running this on effusion and not necessarily on blood samples. If we have a fusion and it has a positive revolta test, we can also look at its cytology and look at what types of cells are present. It should have a low to moderate cellularity and a high protein concentration and low A to G ratio. A therapeutic trial, I think, is something we'll talk about quite a bit today. And so these are cats that you have a reasonable clinical suspicion that they have FIP, but you don't have any of these definitive diagnostics, such as PCR on effusion. And so in these cats, a therapeutic trial of 24 to 72 hours can be considered when you have a suspected diagnosis. Typically, we see their fever and clinical condition improve within a few days. They typically don't become completely asymptomatic or non-clinical, but we do typically see an improvement pretty quickly. One thing I wanted to mention here is we do want to promote the responsible use of antivirals. So when we are talking about therapeutic trials, we should have a reasonable clinical suspicion that we are dealing with FIP and not using it for other viral diseases or just seeing if it works for other diseases. We should have a reasonable clinical suspicion that we're dealing with FIP. We also want to perform these therapeutic trials under direct veterinary guidance and support. And this is important for continuing to think about other differentials if our therapeutic trial isn't working, and also to provide supportive care as a lot of these cats are really quite sick. A presumptive diagnosis is usually what we get in many of these cats. So like I said in the last slide, this can look like characteristic effusion, which is high viscosity, high protein, low cellularity. Once again, we talk about littermates that have had FIP. And then some of these cats that they may be a young cat with neurologic disease, characteristic ocular changes such as uveitis. And in these cases, we do like to see that we have tried potentially other empirical treatments if the cat is stable, or testing if appropriate. In dry FIP, sometimes these cats just look like cats with fevers, failure to gain weight or losing weight. They're unthrifty and may have nonspecific blood work abnormalities such as anemia, increased total bilirubin, and increased globulins. This is one of my favorite images when talking about FIP diagnosis. It's from the AAFP diagnosis guidelines, and it's called the brick by brick diagnosis picture. And so each of these bricks you can see represents a different diagnostic test or finding that you might find when you see one of these cats that you suspect to have FIP. And one thing that I think is important to highlight when talking about this analogy is that you don't have to have all of the bricks to see the clinical picture. So as we start to have more of the bricks, such as effusion and weight loss and fever, the picture becomes more clear, but we patchwork together the different types of testings and findings that we have to come up with a presumptive diagnosis. I also included on this slide an image of the cytology of FIP effusion, and they may not all look exactly the same, but what I wanted to highlight here is that oftentimes you can diagnose these cats just with what you have in your laboratory. So if you have effusion and you are concerned that it could be FIP, make a slide, look at it under the microscope, use your refractometer, evaluate the protein, and start to build your clinical picture in-house. We can go ahead and advance. We'll get into a little bit of the treatment dosing now. There are two primary medications that we'll be talking about today. One is GS and the other is EIDD. So GS, the first thing to mention is that if you have been using black market medications, you will notice that the dosing is quite different. And so that's just an important thing to be aware of when you're dosing these medications compared to previous medications that you may have used. Dose escalation is often necessary, and these dosages typically represent just the minimum dose. And so dose escalation is a good next step if you aren't seeing the clinical response you want right away. GS, it's important to mention, should be given or needs to be given fasted, and so it should be given on an empty stomach. The other medication that is gaining popularity is EIDD or molnupiravir. This medication does not have to be given fasted, and there are some pretty inexpensive treatment options that are coming to the market. And so it's another medication to consider, especially if you're working within a budget. This is a summary of the different pharmacies that are currently offering compounded oral FIP treatment. There are different options available in different places, and there is a pretty wide range of cost for treatment. So finding what works for you and your population and your budget can be helpful in treating these cases. I'll pass it over to Dr. Jennifer.
Thank you, Dr. Colleen. In all honesty, so complete transparency, my cat is the cat in the beginning of this presentation. I lost him 12 years ago to FIP. It was absolutely devastating to me. On a positive note, I have a girl who's sitting like 5 feet away from me right now who is an FIP survivor. She just came out of her observation phase a couple months ago. So I love talking about this, and this is something that everybody here is super passionate about, but it touches each one of us on a very deep level. So we're here to help you guys however we can. So once we're into that treatment part, we want to start talking about some of the follow-up we do with these guys. And this does vary a little bit. It does depend on the severity of the animal. So especially some of the neurologic cases that we have seen, they can be quite severe cats, very ill. They can have a lot of health issues, and having them on a more involved follow-up plan is going to be important. But what we're going to talk about first are kind of our clinically stable kids. So these are usually our effusive kids that don't have pleural effusion. It's more of the abdominal effusion. These are the dry FIP guys that are doing okay otherwise. They are not these really severe, shocky, hypotensive, or the neuro guys. If they are clinically stable and we're in that treatment protocol phase in that first 2 to 4 weeks, and it does depend a little bit. So I want you guys to all know that there is some wiggle room with this. These are not hard and fast rules. They're just some good recommendations. If you have a veterinarian that you work with, finances aren't a big deal with that. If you can actually do a recheck exam in that first 2 to 4 weeks, that's great. It helps that vet see how things are going, helps them have a better idea of how the cat's responding. It's just a good idea to do it if you can do it. The caveat with that is sometimes that's expensive. Sometimes it's hard to get in to see vets. So if that's not a possibility, at least having a conversation with your vet that's helping you in this process in that 2 to 4 week time frame is important. So whether that means if you're in a state that telemedicine is a possibility, doing telemedicine, even if it's just a phone call, an email, or whatever that is with that veterinarian, just having some type of conversation. How's the cat doing? And really what we're talking about in that first little bit is how is their appetite? How is their activity? Do they look and act like they're feeling a little bit better? There's a lot of subjectivity to that, but when it's your cat or even your cat in a rescue organization, you know they're normal. So what we're really trying to find out from you in those first 2 to 4 weeks is, are you starting to see the normalcy of that cat come back? And we will typically see that in that first week or so. You'll start to see them coming back from where they were because they get kind of flat with us. You'll start to see them coming back. So beyond that, we want to do some recheck labs. This is especially important with the cats who have abnormal lab values. We've gone a little bit more lax with the recheck labs. Now we're recommending doing recheck at 6 to 8 weeks, and then again at kind of that 10 to 11 week time frame. So usually that's a CBC and a chemistry value. What we're checking for really are our previously abnormal values, making sure they're improving. So the most common things that we see on labs with these guys, their albumin is usually pretty low. Their globulins are frequently pretty high. So that those values are going to be important. We do see some abnormalities with total bilirubin in a lot of these cats. You can see some abnormalities and even kidney and liver issues with some of these guys. And then anemia and some elevated neutrophils. So those are some of the most common lab values that we have seen. Those are the things that we're rechecking. So that's what we're trying to see at that 6 to 8 week time frame, and then again at that 10 to 11. We're trying to make sure that those values that were abnormal have gone back down to a better level. The most important part of that is that lab value that we're getting towards that 11 to 12 week mark. So at the end of their treatment plan, you want those labs run and evaluated before you decide to stop treatment. You don't want to pull blood, run labs on day 84 and then just immediately stop treatment. It's important that we make sure that those labs are improving. So having that conversation with your veterinarian to make sure that we're all on the same page. Yes, cat looks good enough to stop treatment. Everything looks okay. That's when we decide to stop treatment. So it's not just this cut and dry 84-day, get those labs, stop treatment, done. It needs to be a conversation. And if the values aren't improving, because we do sometimes see that, we sometimes see these guys where we start them on a really great protocol, they're doing good initially, or they're not quite improving like we want them to be. And sometimes that means that there has to be dose adjustment. So you do sometimes have these cats that you just have to alter their dosing depending on how they respond. If you have an ocular or the mild neurologic cases, I'm a really, really big fan of photos and videos for these guys because it is difficult, even from a veterinary standpoint, to remember how severe some of these neuro cats are. We know that they had bad neurologic signs, but we may not remember what it looked like. So having videos where you can track their improvement and seeing how they're doing is a really good thing to do, especially when you're trying to share that with your veterinarian. You take a cat in for a recheck exam and they act a little bit different than they do in their normal environment. So having good videos of these neuro guys is a really good idea. And if you can get good photos so that you can compare how the eyes are changing and improving for the ocular cases. And then again, if they're not clinically stable, so if we're dealing with some of these severe cases that we do sometimes see, you want to follow the recommendations from your veterinarian. If that means that they want to see them more frequently, if it's a really severe case, if they're hospitalized for the first few weeks, sometimes that happens, and that's what you should be following. So this is a very busy slide, and I'm sorry. But what this is, so the Cat World staff at Best Friends, there's a group of them that are super passionate about FIP And one of the things that they do is they actually have a spreadsheet for each individual cat that's treated. And in that spreadsheet, they are tracking some of the most common abnormal lab values that we see in FIP kind of across the board. But what this really shows is as they're going through treatment, how those values change. So it talks about the date of diagnosis, where their values were, and it just helps inform us, especially when we have a good number of cats going through treatment at once. It helps us track to make sure that we're headed in the right direction with these guys. There's absolutely nothing that says that you guys have to do these detailed spreadsheets, but it is kind of nice to see if you are in an organization that is doing heavy FIP treatments, having someone who is kind of a data head, who really enjoys spreadsheets, they really like doing those things. This is a nice thing for them to be able to do, where they can follow along, make sure labs are improving, an easy thing to share with your veterinarian or your vet staff that you're working with, so that they can kind of follow that. So they are phenomenal about this at Best Friends. The Cat World team is fantastic. They do a great job with it. So once we get through treatment, so if we've gone through all of our treatments, we've made it through, we're at 12 weeks, labs look fantastic, and everybody's on board with stopping treatment. So then we kind of have our observation follow-up. So we start that typically right when treatment is completed. So in treatment, next day observation begins. Best Friends is still following an 84-day observation phase. I think that there are some studies out there that may be showing some changes with observation times and even with some treatment times. But right now, everything's still following that 84-day observation phase. During that time, there are some rechecks. So there are some rechecks with labs as well. I think that might have been a slight abnormality there with the rechecked every 4 weeks, because I don't think we're checking them that frequently anymore. But the big thing is we want to make sure that during that time frame, again, the cats are improving, the cats are responding. We don't want to see any backslide in those abnormal behaviors. So if you did have a cat that was not eating well, was febrile, was lethargic, we want to make sure we're not seeing those symptoms start to come back, because that can indicate signs of a relapse. We also check that CBC chem usually about 4 weeks post to make sure there's not anything significant going on there, that we're not suddenly seeing worsening of lab values. Again, the same kind of numbers we're looking for. So we're looking for that albumin, that globulin. If this particular cat had abnormal liver or kidney values, you also want to recheck, be sure you're paying attention to those to make sure those aren't starting to have an issue as well. Overall, relapse is not a common thing to see. So overall, relapse is an uncommon issue unless you have a cat that is otherwise unhealthy or they're in a really high stress environment. So in our healthy animals that are otherwise healthy other than the FIP issue, and they're in a low stress environment, in a home environment, not in a heavily stressed level, the relapse rate isn't a very common thing. It does happen. So we want to make sure that everybody is aware of it, but it isn't a common thing. So I don't want everyone to feel like we're going to just relapse as soon as we're done with treatment. It's an uncommon thing, just to be aware of it. So some of the other things that people ask a lot about and that have recently changed, vaccination. So there used to be some conversations about vaccinations not being done while they were in treatment, or even to some degree while they're in observation. That is no longer a recommendation. So the current recommendation is vaccinations should be performed as they're recommended based on environment and risk. So if you are in a shelter setting, you have a concern about highly contagious diseases, you vaccinate those animals. If they're in a home environment, this is your pet cat, that may be different, but we don't want to discourage the use of vaccinations. Vaccines are important. So that is no longer something that we worry with our treatments or our observations. Spay neuter is the same thing. There used to be some conversations about not doing that for quite a while. That's no longer the recommendation. We're now talking about doing spay and neuters can be performed if there's at least a month left remaining in the treatment. So if you're still have a month in treatment plan so that we can monitor and continue treatment, you can go ahead and spay neuter those cats at that point in time, as long as they're clinically stable. We don't want to spay neuter if they're not clinically stable. If we're deciding to spay neuter or they're of age or of size and there's not a month left, then we just want to wait until observation. And once they're in the observation phase, they can start treatment or they can start the spay neuter at that time. Time-wise, where are we? Do we have time to do either case review?
We have 4 minutes left for your part, so up to you.
Okay, I will just blow through these fast. All right, so we're going to do really quick 2 cases. So the first case, this is Rhubarb. Rhubarb is a best friend's cat. She was adopted. Everything went well, but she developed very rapid onset ocular FIP. She was perfectly fine before this happened. There were no signs or symptoms of anything. During a feeding, a caregiver in Cat World noticed her eyes. They ran some labs on her. The labs were consistent with FIP, along with the iris changes that we see with some of these ocular FIP kids. They immediately started treatment with this girl. She did quite well. We did the ocular doses of the GS. Treatment went well with her. Those were actually her lab values, I believe, in the spreadsheet that we showed before. She responded well to treatment. There were no issues. She survived FIP and went on to be adopted. Did great with everything. It only took, I think, maybe up to a week for her eyes to really start to improve. The redness went away really, really quickly with her. So she had a really rapid improvement. Okay, so the next one is this is a dry FIP kid. She was an own cat. This is actually my cat, full disclosure. She was a 2-year-old Manx that presented with kind of that classic dry FIP. She was lethargic suddenly. She wasn't eating. She just wasn't right. So she's that classic. Whenever I talk to my cat people and I say, if you feel like there's something not right with your cat, voice that. That is where she was. There was something off about her, and I couldn't put my hand on what it was. She just seemed wrong. We did labs on her because there wasn't any effusion. The rest of her exam was normal. She also wasn't febrile, but her labs were very consistent with FIP. We actually, because she was my personal cat, I wanted to do some additional confirmatory tests. So we submitted a protein electrophoresis for her that came back supporting FIP. She was a dry FIP kid. Same thing with this girl. So she wasn't eating well. She wasn't feeling well. We'd seen some weight loss with her. She basically just slept and laid around our house. Within 2 days of us starting treatment, we started her on the GS injections at first, and then we flipped her to the oral pretty quickly. Within 2 days, her appetite improved. Within a week, she was completely back to her normal self. So within a 1-week time frame, she went from being a very lethargic, somewhat lifeless kid to being crazy, bouncing off the walls, running through the house. So that goes along with kind of that treatment trial that Colleen had talked about a little bit as well. If we hadn't run that test on her, and if I was just treating her on a presumptive diagnosis, I would have known within a few days that's what we were dealing with, because she responded that quickly to treatment. We saw big improvement in her within 2 days. She was basically back to completely normal activity personality-wise within 7.
Thank you, Dr. Colleen and Dr. Jennifer, for sharing that information, as well as the stories of those cats, including your personal cats. It's great to have that depth of knowledge about an individual animal. With that, we're going to turn towards looking towards the future, the research side of things. So we will be talking with Dr. Samantha as well as Nicole.
Hi there. Can you hear me okay?
Yes.
All right, great. This is Sam Evans coming at you from Colorado State University. I'm here in Fort Collins today, and so pleased to have been invited by Best Friends, and also very grateful to Best Friends to working on and they are funding a clinical trial that we are running for FIP therapy together with CSU and Best Friends, and I'll talk about that in a little bit. But Nicole and I work together very closely. I saw one of our colleagues, Dr. Wendy Novikoff, is also on the call, which is awesome. We've done a lot of FIP research together, and we've also kind of kept up with the field, and this has been the most exciting time of my entire career. I'm a clinical pathologist, veterinary clinical pathologist and virologist here, and a professor at Colorado State University. So I teach vet med, but I also do research, and this FIP revolution has been remarkable to watch. So we're really excited to be here today and talk about the future. This is just an outline here. We're going to talk about the future of FIP treatment in terms of new options, combined options, shortening up that 84-day window that the docs referred to earlier. And then also just a little bit about the pathogenesis and how that continues to evolve, especially with the FCoV 23 outbreak I'm sure you all have heard about in Cyprus last year. I'm a diagnostician, I'm a pathologist, so I'm all about diagnostics, and so that there are new things coming down the pipeline I want to touch on. And then Nicole's going to talk about heredity and susceptibility to FIP, as well as a little bit on prevention. So if we can just go for the next slide. I just wanted to put a plug. I saw there were some people from around the world. Somebody chimed in from Australia. We do have now legally prescribable drugs available for FIP in many countries across the globe, and this is changing all the time. So it's easily possible that even this is out of date. I got this slide from Dr. Sally Coggins about a month ago, but you can see all the countries listed here have either BOVA, Optimus, Stokes, and SVP, and others in the United States, like Dr. Jennifer was showing earlier. So it's just, it's great to see this expanding across the globe in terms of legally available, legally prescribable options for veterinarians. I'm very excited to see that. Obviously, as of June 1st this year for those in the United States with me. In terms of what options we're treating with, they went over very well that the main line drug that we recommend as first line therapy in general for this disease is GS-441524. There are other nucleoside analog drugs, the molnupiravir EIDD 2801, which was mentioned earlier, and then also remdesivir, which is a prodrug of GS and also available for the human market for COVID-19 in the form of a product called Veklury. Veklury is nice because it's injectable, so whenever I get in touch with someone who has a really severely neurologic cat who's unable to swallow and unable to take oral medications and they don't have an E-tube placed, then I'm going to recommend that they try to get Veklury because it's a parenteral administration, which is nice there. And then Paxlovid is a protease inhibitor that is available. It's a Pfizer drug, also available for COVID-19 and can be used off-label as well. So Nicole's going to talk about the other protease inhibitor now.
Yeah, so this is something that has actually been around longer than any of the other things that we've been talking about. GC376 was actually the first antiviral treatment that succeeded in curing FIP. So the very first cats cured of FIP were cured with GC376. We haven't heard as much about that lately, but there's a company called Anaviv, who is working towards full FDA approval. So in other words, bringing this to market as a drug specifically targeted for FIP. They are on the fast track for this. Unfortunately, FDA approval, as we know, takes a lot of time, but they are being fast tracked as much as the FDA can. They've submitted a reasonable expectation of effectiveness, which is what helps them sort of leapfrog some of the other trials they would normally have to do. In terms of when we might expect to see this, we've heard possibly even next year. I have not heard an update from Anaviv recently, but the last that I had heard from them was 2025. So fingers crossed, hopefully we'll have some new options with this. And we're going to talk a little bit more about how this might dovetail with some other future treatment options. So if you want to go to the next slide. Because we can actually combine antiviral treatments and get even better effectiveness if they are synergistic with each other. And we know that there is synergy between GS and GC376. Another advantage of this, in addition to just being more effective, is this also will help prevent viral resistance. And this is a really common strategy that's used in human medicine for viral diseases. For example, HIV, AIDS. You don't use just one antiviral, you use 2 or 3. And that's to prevent the viruses from becoming resistant to those drugs. And then suddenly you don't have anything left that works. So there's a really interesting paper out there that was published in 2022 that actually showed that they were able to reduce treatment time for a certain group of cats. I believe it was mostly wet FIP cats. But in combination, they were able to do only 4 weeks of treatment, which is pretty amazing. 4 weeks instead of 3 months. I think everybody would like that. And then if you want to go to the next slide. Also, on the shorter treatment duration, at this time, the current recommendations for the length of treatment have not changed. So just, I want to be clear on that. Like, we're talking about this as in the future, we expect the duration of treatment to drop, but we don't quite have enough information to confidently say, is this going to be for all cats across the board? Is this going to be for cats with a certain type of FIP or certain severity of FIP? But there was this great study that came out fairly recently where they showed that using like the current oral GS tablets that are available as compounded tablets from Bova on the market now, they were able to do a short treatment of only 42 days at the normal dosages with the same effectiveness, the same survival rate, which is pretty amazing. There's a much larger, so this was a small sample size. So that's why we don't want to predict too much out of this. We need a wider group of cats and a larger number. But there is I think it's something like a 700 cat trial that is already in progress to try to expand on this. And from that, we hopefully should be able to make some adjustments to treatment duration. And then
speaking of which, we have this ongoing clinical trial here at CSU in conjunction with Best Friends in Utah and a MedVet location in Columbus, Ohio, where we're trying the combination of oral GS and oral GC376. So that is one nucleoside analog and one protease inhibitor that we're using orally. That LV paper that Nicole referred to earlier that got treatment duration down to only 4 weeks was using injectable formulations of both. And so kind of the iteration that we're going for is oral, which we know has decreased morbidity for the animals in terms of the adverse effects that we see from a lot of those injections. So we're really trying to stick with the orals, but also combining 2 different drugs from 2 different classes to try to decrease that duration of therapy. And so we're, again, very grateful to Best Friends for funding this study and for also partnering with us and enrolling a lot of the cats there in Cat World in this study to try to optimize therapy for FIP.
Okay, so switching away a little bit from treatment, one of the things that we'd really like to know more about is how exactly does FIP develop? How does the virus spread? We'd like to know more about FCOV. And we had a really interesting occurrence in the last year or two here, where there was an actual outbreak of FIP, and it was actually big enough, it made the news, which is kind of unusual for a cat disease. But so we had this sudden spike in FIP in Cyprus, and researchers have gone in and have been studying this, and they've been finding some interesting things about the strain of the virus that is there. They have found out some interesting things about, horizontal spread. And so it has, raised a lot of questions that there's all these things that we just don't know about. What are all these different strains that might be out there across the world? How are things moving around amongst these groups of cats? And are some of these strains more virulent? And that is, for example, something that in previous papers has been, hypothesized as the cause for when we see these things like outbreaks of FIP in the shelter, that maybe you have a more virulent strain of the virus, and that it's not horizontally transmitting because they couldn't find evidence of that, but that you had a particular FCOV strain that was very mutation happy. So Morris Animal Foundation and Every Cat has put $1 million, which is huge in the world of animal research, to help try to track some of this down. So there's going to be some really interesting things coming from that. And, in the meantime, there's also lots of other research that's going on, for example, showing that there is cross-species transmission happening, for example, between wild cats and domestic cats. So there's lots of interesting directions that this is going. And the more that we understand about how FIP develops will help us get a better handle and hopefully prevent these scary things. Like an outbreak of FIP sounds pretty scary to me. So we want to be prepared and know how to handle these things. Next slide. So another thing that we'd really like to know more about is we know that there are genetic factors that affect a cat's susceptibility to FIP. And we don't know a lot about exactly how that happens. We know it's polygenic. It's a lot of different genes involved. And we have some studies that have been coming out trying to sort of tease apart what these genes are. It's probably not going to come down to a nice simple test where you can just say like, yes, this cat is going to be prone to developing FIP. There's going to be a lot of factors, but there may be some way to turn this into a way of assessing risk, or of helping us understand how we should look at cases. And in the rescue context, think about this. When you get a kitten that develops FIP in a litter, what do you do about the other litter mates, right? People ask, well, should I hang on to them longer and see if they develop FIP? Should I warn their adopters? So there's lots of questions, and we'd really like to have a lot better information to give people better guidance. And then just as an example here, I have a couple pictures. This is Strawberry and Peaches. They are biological sisters who were adopted together. Strawberry developed FIP a couple years ago, did great, is doing well today. And 2 years later, her sister Peaches also developed FIP. Luckily, Peaches was able to have her FIP now when we have regulated oral medicine available. So what you see in that second picture there is Strawberry is actually wants Peaches medicine as a treat. She's very upset that she got the injections and Peaches gets the treat out of the bottle. So anyway, happy story. They're both doing very well. But wouldn't it be great if we had better guidance so we could tell what should we do for these cats that may be at higher risk but haven't yet developed FIP? Next slide. And finally, the ultimate goal is, wouldn't it be great if we didn't have to deal with FIP in the first place? Vaccines have such an important place in veterinary medicine. For example, I don't know about you, but I would much rather vaccinate cats for Pan-Luc than deal with Pan-Luc outbreak. So same thing for FIP. Wouldn't it be great if we could just vaccinate them? And there was a previous effort to create a vaccine for FIP. It actually is still out there on the market. Do not use it. It is not effective. And in fact, there have been studies that show that it actually may increase the chance of a cat developing FIP. Part of the reason it's not effective is that in order for it to have a chance at being effective, you have to give it to a cat who has never been exposed to FCOV. And you can't give it until they're, I believe, 14 weeks old, at which point nearly every cat and kitten is going to have been exposed. So it's really, there's almost zero window where this is useful. So don't use it. Before we go to the next slide, I just want to give a shout out. This is Peanut. He was the first foster kitten that I treated for FIP. He's going on 5 years from his diagnosis date. And he is doing great in his adoptive forever home. And they love him a lot. Okay, next slide. So what's really exciting is that there is a new mRNA vaccine being developed at UC Davis. They're taking advantage of the vaccine technologies that were developed during COVID. So there's some very exciting progress happening on that. Realistically, though, I mean, we're still talking, it's going to be years before we see this, but it's looking very promising. And there was a lot of, doubt, like, could we even really get a vaccine given the history that we have with this, previous not useful vaccine? And the answer is looking like yes. So it's looking very promising that, someday what we'll actually be here talking about is some new vaccine that you can be giving the kittens in your rescue or shelter and avoid FIP altogether, or at least decrease the severity. So very exciting. And next slide.
All right, this is back to me since I'm a pathologist, can't help talk about exciting new ways to diagnose FIP. And as Dr. Jennifer, Dr. Colleen mentioned earlier, it can be real challenging. There is still not a perfect, in my mind, there is still not a perfect antemortem test for FIP. And among FIP researchers, kind of the gold standard or reference method is necropsy with histopathology, which used to be standard of care as these cats used to die, right? And now they don't. And so we really need a better test now that we can treat this clinically so well. And so, you know, these are kind of new wave diagnostics. There's an AI image there of a cat surfing that is AI generated, in part because these are the new wave, like the next generation basically of FIP diagnostics, but also because I have an AI diagnostic platform on here. But first and foremost, response to therapy, we certainly consider that supportive of a diagnosis of FIP, but I've swung my pendulum all the way from being a purist and saying we always need a ton of diagnostics to no, we don't need so many diagnostics, we can just try therapy. And now I've kind of swung back to the middle. And that is because the problem is when they don't respond super well, or if they kind of just peter along when you start an antiviral drug treatment, you can kind of be chasing your tail in terms of getting a diagnosis, because if you wait until after antivirals are on board to try the PCR or try the ICC or whatever it is, then all of a sudden the virus is going to be gone, you know, and so you don't know at that point if the treatment failure is due to the fact that you're not there's viral resistance, or you're not hitting the right tissue concentration in terms of PK data, or if the cat never had FIP to begin with, you know, so you can kind of start chasing your tail if you treat too many cats without having a kind of a more concrete suspicion of FIP to begin with. But certainly response to therapy is supportive, and we use that all the time now. MFICC is something my lab has been working on, multiplex fluorescent immunocytochemistry, as well as a flow cytometry-based platform. That's just kind of an iteration on the old immunocytochemistry and immunofluorescent assays. You can do that on aspirates of fluid or tissue, and so that can definitely lend a hand in diagnosis. People are working on plasma proteomics, novel serum biomarkers. Is it possible that we'll have a SNAP test one day with 3 different biomarkers that could be predictive of FIP, especially since host response is so important to the pathogenesis of this disease? As we know, it's an individual cat issue for the most part, with some exceptions like Nicole talked about in Cyprus. And then this is the one I'm really excited about, this machine learning algorithm. Myself and 5 other universities around the world have been collaborating on trying to devise or train a machine learning algorithm to diagnose FIP using ClinPath data. And so that's, I mean, it's kind of what we already do in our minds, you know, as clinicians. We kind of look at data and kind of algorithmically put weighting on certain features and less weight on other features. But this is using, you know, the power of machine learning to be kind of massively multiplexed in terms of data. And I think this could be a cheap, fast, and effective way for shelters to diagnose FIP, because if you have a CBC in biochemistry and you can input that data into the algorithm, and you'll get a probabilistic output in terms of the likelihood of that animal having FIP, I think it'd be super cool and super cheap. So we are working on developing that. Other people are looking at non-S gene mutations. The IDEX assay was mentioned earlier, but people are looking outside of the spike protein, as well as whole genome, like sequencing the whole viral genome in terms of getting a feel for, is this a mutated form of coronavirus? I know there's another group looking at CRISPR-based point of care diagnostics, Raman spectroscopy, all of which to say there's a lot happening. This is an absolute revolution, not only in treatment, but also in diagnostics for FIP. So please watch this space. More to come, I would say, but it's very, very exciting time. So next slide.
Okay. And so one of the things that people are asking me all the time is, what can I do to help FIP cats? What can I do to spread the word to everybody? And the number one thing that anyone can do is make sure that the vets that you interact with and that are in your communities are aware that there is treatment for FIP, that they can prescribe it, that it can be affordable, that there are many options, and that there's lots of information out there. And then number 2, we need to help people find vets who are up to date on this information. This stuff is changing so quickly. So we really need to make sure that people can quickly find a vet who's going to be able to help them get their cat on treatment. So there's a website, fipfriendlyvet.com. And I would encourage everybody to, if you haven't already, go here, nominate vets that you are working with, that you know are helping cats with FIP, or talk to your vets, spread this in vet groups. The more people that we can reach so they can find a vet and get treatment from day one, the better and the higher the survival will be for cats with FIP. Okay.
Amazing. Well, thank you so much, Nicole. Thank you, Dr. Samantha. Thank you to all of the cats that we showed today for letting us learn from them. With that, we're going to move on to the question and answer part of this webinar. I'm going to start us off. We know that in animal welfare, buy-in is everything. We need the community to be on board with what we're doing, especially if we're going to change anything. We need our board members, our donors, our volunteers, our fosters, our adopters to know what's going on, right? So what would be 2 to 3 points that you would share with your community in order for them to both understand FIP and the investment that we need in it? And anyone can.
Okay, I was just going to ask you. I mean, I think what Nicole just said at the end there, and we're still on this massive information campaign because we still run into vets who don't know about this stuff and still recommend euthanasia for FIP. I mean, that's still happening today. So mainly just know that treatment is out there, know that there are people like us that are happy to help you with it. And for me, I mean, I'm trying not to sound melodramatic, but this, I mean, it is a spectacular time in veterinary medicine. We have not seen a change in paradigm like this since, in my opinion, since the invention of antibiotics, because this is a brand new total class of drugs, antiviral drugs, that we've never used to treat life-threatening diseases before. So with very rare exceptions of the herpes viral drugs, we've never used antivirals at all in vet med, and now we're saving a previously 100% fatal disease. So it is remarkable, and I just couldn't be more excited. I guess that's what I would want donors and board members to know.
I would also add to empower veterinarians to think about how many times they've learned about a new drug and then incorporated it into their practice, and just really feel like this isn't any different. Like, we have learned about monoclonal antibodies and started using them. We have learned about things like Serenia that weren't even around, you know, when 30 years ago, and now they're a staple in our practice. And so I would just encourage veterinarians to think about this muscle we've flexed in the past and to flex it again. This is a new drug. It's just like all the other new drugs that we've learned about since we've graduated vet school, and just figure out ways that we can build it into our practice.
That's amazing. Thank you. Got a
I would
lot
say
of
the other thing. Oh, sorry. I'm just going to throw that in there really quick too. The use photos and talk about lives saved. So we all talk about that in animal welfare. We're trying to save lives, but this is something that, like Dr. Samantha was saying, that this was 100% fatal. Like, I would have literally done anything to have saved my cat 12 years ago, and there was absolutely nothing I could do for him. And now we are able to take these cats from death sentence to happy lives. So that is a huge donation driver. That's a huge PR campaign driver. Like, you can get people behind it. You just have to use the right language.
Thank you. Yeah, that's great. Language is everything, we know. So we have a lot of questions today, and way more than we're going to get to in the next 6 minutes. A lot of them are incredibly specific. So knowing we can't get to them here, what would be the resources that you would recommend that our attendees go to next to get their questions answered?
I'll chime in here and say that one thing that I think has been great, and this was and I don't work for Stokes Pharmacy or anything, but I think Stokes Pharmacy has been really good at also trying to help with the information campaign. Actually, the other compounder now making molnupiravir is doing the same thing, but a lot of these compounding pharmacies now are publishing free webinars on their websites. So if you want more information, and they've been, myself, Nicole, a lot of other FIP experts from around the world have been doing these webinars. There's actually a lot available for free. And I actually think that the compounding pharmacy websites are a good place to go for it.
I want to just mention FIPvetguide.com. I've seen some questions in the chat. For example, there was a shot of that list of pharmacies. That's all available there. So it has a lot of information about availability, about protocols, about monitoring, and so on. So a lot of these questions, there's a FAQ. You can probably get a lot of those questions answered on that site.
Great. Thank you.
Yeah, I would second that. I think they already dropped it in the chat at some point, the FIPvetguide.com. Yeah.
Perfect. So we have a lot of people asking about money. So with the changes in the available treatments in the last few months, with a lot of our attendees in budgeting mode right now, how would you say they should approach the question of money when they want to do FIP treatment really well?
So I just want to step in. One thing that I've seen that has been amazing just in the last few months is the number of shelters that have come and said that because there's now regulated treatment and it's affordable, that they have been able to, for the first time, treat FIP cats instead of just euthanizing or hoping that a rescue would take them. So this is very, very doable. I think the first thing is just look around at any given time. Like if you're watching this at some point in the future, anything we say about what pharmacies are available will probably be out of date. More and more pharmacies are offering more and more options and at very different price points. But there are some very affordable options. It's very doable, depending on the size of the cat and the dose that they need, to do treatment for $100 or $200, depending on, like for kittens, you can do treatment for $100 in a lot of cases. So there's been a lot of talk about like, this is thousands and thousands of dollars of treatment. Like just reset everything and check where things are at the current time, because it's always changing and it just seems to be getting better and better.
And the thing I'd add to that, and we kind of touched on this briefly, but it does appear. I love the competition. I mean, the competition is great, right? Like more and more pharmacies are getting into the market, and I think it's good for cats because I think it's making it cheaper. There does appear to be a decent price differential between that mainline drug that we talked about, GS 441524, and then the kind of, in my opinion, less preferred drug, molnupiravir or EIDD 2801. Those that differential does not prevent me from recommending people use the cheaper drug if they cannot afford the GS, because it is still, I think, pretty effective as monotherapy. The hesitation there comes from its slightly lower safety profile, more cases of adverse events, and also there is some concern about mutagenesis with that drug, to where it can be a driver of mutations. We've seen that with COVID-19. That said, I would sooner see a cat treated with molnupiravir than die 100% every time.
I unfortunately have to cut us off there, even though there are many other great questions that we could have answered today.
Bye. Thank you.
Bye.
Bye.
Thanks, everyone.